Dr. Meng.
Morning, Chairperson, ladies and gentlemen. My name is Meng. I'm from Tri-Service General Hospital, Taipei, Taiwan. We know that chronic ketamine use may cause ulcerative cystitis and bladder dysfunction. Recently, the pathogenesis of ketamine cystitis has been linked to immune response to ketamine. However, it has not been established. So this study, we propose an possible immune mechanism to explain the pathophysiology of irreversible bladder damage of ketamine cystitis. 53 KC patients and 21 healthy volunteers were included in this study. Plasma cytokines levels were measured by ELISA. Flow cytometry was used to assess the population of Th1, Th2, and Th17 in CD4 positive T cells. The mean age of the KC patients were 23 years old, and duration of ketamine abuse was about 50 months. And urine white blood cells and serum creatinine were slightly increased in KC patients. We also found that IgE was increased in KC patients. Eosinophil and neutrophils infiltrate in suburothelium layers, and we can also find that collagen deposition in muscular layers. In Th1 and Th2 and Th17 populations significantly increase in KC patients. We also found that elevate interleukin-6, TNF-alpha, and interferon gamma in KC patients. However, tumor growth factor beta significantly decreased in KC patients. In conclusion, our study showed that ketamine may cause acute inflammation through a Th1 pathway. Ketamine also promotes IL-6 production and then links to the Th17 cell function, therefore cause tissue destruction and collagen deposition. Interleukin-6 may also promote the differentiation of Th2 cells by enhancing endogenous IL-4 activation and then increase the level of IgE. IL-6 may also suppress Treg cells, therefore aggravate the chronic inflammation in KC patients. So we think that Th1, Th2, and Th17 and Treg cells imbalance may involve the pathogenesis of ketamine cystitis. Thank you for your attention.
So we're open for questions.
Thank you very much for your presentation. So that means maybe the immune response, that should be systemic. How would you explain that only noted in the urinary bladder?
Yes, that's a great question. Yes, that's our observation. I think there's something in bladder that might be a target to induce the acute inflammation. That might be the case. The pathogenesis may started from the direct toxicity of ketamine and then induce the acute inflammation, and then something will start the response of the immune system.
Okay, thank you.
Yeah, I think we need more evidence to support that.
Isn't that just a good way of saying we don't know? Can I ask a much more mundane question? The volunteers you had in the study, where did you recruit them from, and how did you get your urothelial samples? How did you take your samples?
The samples are from the Ketamine Cystitis patients, not from the...
So there are no urothelial samples from the...
No, from the healthy volunteers.
Okay, thank you.
So I think, one question for you. I think that the treatment of case is a clinical dilemma. So in your study, I think the immunogenic reaction is one of the important pathogenesis. So any immune therapy in your clinical practice, and what's the result?
You mean the immunotherapy?
Immunotherapy?
No, we haven't started immunotherapy.
Or for example, any potential?
Yeah, I think so, yeah. If IL-6, as I mentioned, that if IL-6 is a key role, then we might treat the Ketamine Cystitis with IL-6 antagonist in the future. There's some IL-6 antagonist trial is ongoing. So I think there might be a potential for IL-6 antagonist, to treat KC.